Iqbal Mohamed.
Thank you, Madam Deputy Speaker. The bill gives us a real opportunity to modernise mental health law and to make sure that patient choice and fairness are at the heart of the mental health services. But to achieve that, we must first confront the deep inequalities that still shape people's experience of mental health care, particularly for ethnic minority communities, those facing economic hardship, and for young people. Like so many issues, the intersectionality between these factors means some groups face particular challenges in navigating and accessing the help they need. In Dewsbury and Batley, we see the human reality of that inequality. Rates of depression stand at 15.4%, higher than the national average, and schizophrenia is also more common locally in comparison to other constituencies in the UK. Across Yorkshire and the North, mental ill health is consistently higher than elsewhere in England. NHS data and mental health organisations are clear. Both ethnic background and wealth disparity play a major role in this gap. People in my constituency are more likely to experience a mental health condition, yet the funding for research and specialised services in the North remains lower. That means less support, fewer beds and fewer opportunities to provide specialist care. That is why I strongly support new clause 13 that requires every hospital to have a named person responsible for overseeing race equality in how the Mental Health Act is applied. Black people are still 4 times more likely to be detained under the Act and 8 times more likely to be placed on a community treatment order. Without accountability, those injustices will continue. I also support new clause 35 in the name of my honourable friend from Sheffield Central, which seeks to put limits on CTOs. We must also do far more for young people, and the new clause proposed by my honourable friend from Hertford and Stortford powerfully argues for giving under 16s a clearer say in their own treatment decisions. A mother told me how both daughters needed mental health support, yet she had to seek private care because local services were overstretched and not up to standard. She pointed me to the Good Childhood Report, which shows that children's well-being in the UK is amongst the lowest in the UK. I also support new clause 28, which proposes the urgent need to stop children being placed in adult wards or sent miles away from home for treatment. So I welcome the work of West Yorkshire ICB done recently to expand mental health services for older people, but we must match that ambition for children and young people too. If those commitments cannot all be secured in this bill, then this must be delivered in the forthcoming Children and Wellbeing Bill.